Timeless intimacy, one of the things that you came up with. Tell me about that. What is it?
So timeless intimacy is a protocol that I actually trademarked and created, and it is a procedure or sequence of procedures by which you could take a patient who is of a certain age, usually it's in their 40s to 50s, and really turn back the clock in terms of their intimacy. These are women who are not experiencing the same pleasure they've had with sex. These are women who've had maybe possibly pain with intimacy, or they just simply don't feel like themselves in the bedroom again with their partners. So timeless intimacy was actually created and invented, actually coined, as a way to enable patients to be able to earn and feel that way again with their partner.
So what procedures are you actually doing?
So the procedure we're doing in timeless intimacy include a small surgical procedure that tightens the vagina, injection of healing factors into the vaginal tissue, which may or may not include stem cells, and apply a heat, usually in our practice we use a laser, to basically finish the whole procedure off. And so the combination of these sequence of events, what we call the timeless intimacy protocol, can actually enable patients to go from, say, a 50-year-old experiencing what a 50-year-old experiences during intimacy to a 20 or 30-year-old. Our patients are very, very happy.
So they will enjoy sex the way they did in their 20s.
Exactly.
As far as the feeling of it.
Right.
The sensations of it.
Yeah, and because it actually requires more than one modality, we're actually hitting different areas and different issues. So patients often, I had a patient of mine basically tell me that when she's turned 48 after having 3 kids, she just doesn't feel the sensation of intimacy as much. And so after she basically underwent the timeless intimacy protocol, she told me a few weeks after the procedure that she feels more confident, she feels sexy again. She feels like she wants to have intimacy again with her partner because the libido is there, the intimacy is there.
Does the partner notice the difference?
The partner definitely notices the difference. I've actually had a few thank you cards from the partners thanking me for saving their marriage, actually. And that's just so rewarding, especially as a GYN surgeon, to hear stories like that. And when the patients have better intimacy, they feel better about themselves. You know, that inner smile comes out, they feel confident, they feel sexy, they feel like they could take on the world. And it's that feeling is what we're really going for. And yes, there's timeless intimacy, which can address a lot of the issues they have with lack of sensation, maybe that pain with intimacy. All these actually go in the consultation and into the procedure. But what that means for the patient is that they feel better about themselves.
Now the pain. You brought up pain quite a few times. So this is very common.
What's causing it? So it depends, right?
So intercourse is causing pain.
So not necessarily. So
Okay.
so pain, there's a variety of different reasons for pain. You could have endometriosis that can also cause pain, which is inflammation of the pelvis. Or more often than not, my older 40-year-olds are having pain because the tissue down below has become dry. Simply put, they feel dryness down below. And remember, the mechanism of action.
So they need a lot more lubricant.
They need more lubricants. Now, to my patients out there, potential viewers who are in the CVS aisles, going down aisle after aisle looking for all the lubricants, they oftentimes will tell me that the lubricants wear off within a few minutes to, if it lasts at all.
Then it hurts again.
And then it hurts again. Because what we're not doing, Randy, what we're not doing is we're not actually treating the underlying cause. And it's usually a deficiency in hormones that causes that lining to be well vascularized and lubricated. Now, with just a little bit of hormone replacement, usually estrogen, combination of estrogen and testosterone, did you know there are thyroid receptors vaginally? All these actually contribute to the overall milieu or the vaginal health that enable patients to have sex comfortably.
And they start feeling better right away.
They feel
after
better.
The hormones
after
and
the
these
hormones.
other procedures.
Now, the patients, right, they seek me. So they're telling me their libido is going up, and once the libido goes up, guess what happens? They have more intimacy.
So when you say libido, we're talking about desire.
Desire.
The desire to
so
want.
libido is desire. So now the hormones are optimal, they're wanting their partner again, whereas before they'd come home and say, I can't remember this guy I married. And then they all of a sudden they come home and say, hey, this guy looks kind of good again. And so, you know, that part of it is great because that confidence comes up, but then there's a wear and tear issue. So as more intimacy is sought and more intimacy encounters are going up, then the patients are needing more. That's where doing an O shot or doing a femilift or a vaginal laser can help a lot.
You know, this whole aesthetic medicine, you know, as I'm listening to this, because I interview a lot of plastic surgeons, that lasers and facelifting and things like that for the face to look younger.
Sure.
Body contouring to get a younger looking body.
Absolutely.
Now, it sounds like this movement now is to, in this case, like a sexual organ, to return that, make that younger.
Absolutely, and I think
right?
I think Randy, you just nailed it on the head, because the movement is not I want to go and get a procedure to get older or be less functional. It's I want to have a more younger, vibrant feeling, and it's just no different when it comes to intimacy and pelvic health. And I think it's just now coming to the forefront and coming to light now because we have all these different tools, we have technologies now that enable us to be able to have intimacy comfortably and with more satisfaction.
You and your father have created, I guess, a cutting edge center of excellence, where all the newest, latest stuff is being offered right there.
Exactly.
Is that right? Because you're always going to conferences, always
Absolutely.
learning new stuff. In fact, you were in San Diego this weekend.
Yeah, absolutely. And so I think what we're really kind of proud about is we are the cornerstone for all things women's health in West
So it's not a
Covina.
typical gynecologist.
Not a typical OB/GYN office. I know it's really interesting. I had a patient of mine, a new patient about a month ago, and she walked in, I did the whole consultation. It was actually for an O shot. And she told me at the end of it, she said, you know, Dr. Tangchitnob, when I walked in here, I felt like this was a place of healing. And
Nice.
that really, really resonated with me because that's actually what I built this center for. So my father and I, our family is really representing the cornerstone for women's health in our area. I came home. I came home to my hometown to practice. You know, I trained.
Because you were in Beverly Hills.
I was in
area.
Beverly Hills. I was at Cedars-Sinai. I was in La Jolla. I was in San Diego at Scripps Clinic. I had plenty of opportunities to take jobs there. But I really wanted to go home. I wanted to serve the community that I grew up in, and I wanted to do it with a cutting-edge, innovative approach that no one else is doing.